Hi, I'm Dr. Cynthia Clark, acupuncture physician, applied clinical nutritionist, and creator of Energy Evolution. And one of the most common questions that I get in clinic is whether or not I'm losing my memory. Not me, my clients. And so I want to talk to you about that a little bit today. I want to talk to you about some of the common causes for memory loss. I want to talk to you about the difference between normal memory loss and like stress-induced memory loss, and what might be signs of cognitive decline in the Alzheimer's world. And I want to talk to you about some things that you can start doing for yourself right now, right away. So the first thing that we're going to cover is normal memory issues. The reason that this can happen, so first of all, by the way, lots of people have cognitive decline and even Alzheimer's as they get over. In fact, statistically, 11% of Americans over the age of 65 have Alzheimer's. That's a lot. And ladies, you're in a higher risk group. 2/3 of people with Alzheimer's are women. So in addition to that, the earliest signs of Alzheimer's are reported to start showing up about 10 years after the neural degeneration starts taking place in the brain. So if you want to prevent Alzheimer's, start now. A couple of the things to be aware of are: 1, inflammation as it flows through the body. Things that you can do for this. Number 1, and the most important, is exercise and drink water. Every single medical professional that I've ever studied in every single discipline, conventional, integrative, holistic, across the board, every single one of them reports that increased blood flow reduces inflammation and it increases cognitive functioning. So you want to do at least 20 to 30 minutes of cardio activity per day. This is critical. This is essential. This is like God's grace. Whatever else you do, you might do a little so good on your food, you might do so bad. Either way, get the blood moving, because that will flow the inflammation through, and that will give you a lot of leeway on keeping your body and your brain in good health. Number 2 is drink water. I'm giving you the punchline first on all this. You can listen to the details later. Number 2 is drink water. That is because all of our neural pathways, neural signals, happen through the conductive material that is our bodies, and we all know that water conducts electricity. This is why you do not want to be in the ocean if it's lightning outside. Water conducts electricity, and we are electrical, fabulous, energetic human beings, and we want water in order to be able to properly send those signals throughout the body. Another one is food. So sugar is inflammatory. You want the least amount of inflammatory foods. So good quality foods, higher fat foods, and I mean healthy fats. So your coconut oil, your avocados, your fantastic olive oils, the really good quality ones. I like to go to a local olive oil company. I often find myself at Venice Olive Oil Company here in Sarasota, and get the one in the far back left that has the highest phenol count, the highest count that you can get for those healthy fats. And then finally, the last one is meditation, breathing and meditation. So a very, very, very simple way to start on this, or a system reboot if you haven't been meditating in a while, is when you breathe in for a count of 4, breathe in, 2, 3, 4, hold for a count of 4, 2, 3, 4, exhale, 2, 3, 4, hold, 2, 3, 4. This is one of the most powerful techniques that you can do. I first learned it through my martial arts and Qigong training back a couple of decades ago, and it was most recently popularized by Mark Divine in The Unbeatable Mind. He's a former Navy SEAL that produced some books and some huge programs on how to cultivate mental strength and endurance. So those are 4 things that you can start doing right away: water, food, exercise, and meditation. Okay, but I want to tell you more about the types of cognitive decline that we can have. So normal memory issues are classified as 6 different types. By the way, if you're not interested in the details, you can turn off here and you've already gotten your good information for the day. Normal memory issues, number 1, are transients. This is just forgetting facts over the time. If you don't use it, you lose it, right? So just regular transients. Number 2, absent-mindedness. This has to do with not really paying attention to what you're doing. So you're driving along and you find yourself at home when you meant to go to the grocery store because you were tuned out and thinking about your workday. Number 3, blocking. So the answer's right on the tip of your tongue, but you can't quite bring the word up. Most people can retrieve that word in 1 to 3 minutes. If it's taking longer than that, then that could be an issue of a signal of more memory issues. Misattribution, so remembering something accurately except for a small detail. So this can also end up as accidental plagiarism, like you think it's your idea, but actually somebody else said it before you, maybe a couple hundred years ago. Number 5, suggestibility. This is one of the most common ones. Information learned after the fact is incorporated into the memory. This is, there's a really interesting book called Persuasion, and there's some stories told about false confessions, so people who believed temporarily that they were guilty of a crime because of the suggestibility techniques that the police used in order to convince them that they had in fact committed that crime. And number 6 is bias. That's an extreme example of suggestibility. Bias. So moods, beliefs, prior knowledge. If you're in a bad mood when you walk into that restaurant, you're going to remember it being a horrible place. And if you're in a great mood, or if you got engaged there, then you might remember it as being the most beautiful place on the planet. So those are 6 types of normal memory issues. It's not dementia if you forget where your wallet or your keys are. It's not dementia if you forget a word or someone's name, or if you miss an appointment. It might be dementia if you get lost while you're driving around in familiar areas, places you've been to a lot, when bills start not getting paid, or when skills that you've had your whole life start to rapidly deteriorate. You've always known how to knit or crochet, and then suddenly you sit down one day and you can't remember how to do it and it doesn't come back quickly. Western medicine, unfortunately, does not have a lot of benefit in this area. In fact, out of 245 drug trials, 244 have failed outright. What this means is not that there is one wonder drug for cognitive decline, Alzheimer's. What this means is that we can describe cognitive decline as there are many different pathways leading to cognitive decline. Let's say there's 36 different ways that you can get there. 36 different ways, one drug. So that one drug might treat one of those 36 different ways. That whole construction of your memory is built upon the foundation of the water, the food, the exercise, and the meditation practices that you do. So that's going to help keep what you've got strong. And also, there's more that can be done. And I want to make sure that you're clear on the differences between normal and Alzheimer's types of dementia. Okay, let's get a little bit more into the technical reasons for Alzheimer's. So some of the reasons that Alzheimer's can take place is trauma, car accidents, falls, footfalls, concussion. I had a young lady come to see me. She'd had concussion. It was actually her 3rd concussion, even though she was only 19 years old. And she came to see me at the beginning of her winter break because she'd come home from college and her mother said, "This is not how my daughter normally acts. Something's not right." So they came to see me. We did the work that we do here on our clients, which is our full 6-step process. And within 24 hours, she was showing marked improvement in her memory and her personality. Her own personality was coming back because the inflammation was cleared up that quickly. Someone young, we can see those changes very quickly. So trauma, leaky brain. So if you've got concussion, then you can have inflammatory cytokines that are flowing through the body, and they can get lodged in the brain. And when that happens, then the brain will not properly send the signal to the vagus nerve, which is what transmits the signal to the digestive system to work properly. So that means that leaky brain causes leaky gut, and of course, once the digestive system is compromised, then leaky gut causes leaky brain. So it's this vicious circle. Number 2 is inflammation. So while sugar is one of the leading causes of inflammation in the body, the teeth are one of the biggest areas where we can see infections that will enter the bloodstream directly. So your tooth infection is very important to take care of that, because the inflammation from that can poison the bloodstream and can affect the brain. Alzheimer's disease number 3. Alzheimer's disease has been described as type 3 diabetes. And that really hits home with me, because I have diabetes on both sides of my family, and I have Alzheimer's on one of them. So I'm a person that really wants to pay attention and take care of these things, because insulin resistance on the brain is not fun. If you want your brain when you were 75 years old, especially if you were female, if you want your brain when you were 75 years old, then follow these principles now. And if you start noticing anything amiss in your health, not necessarily your brain, but in your health at all, especially achy joints or difficulty getting up in the morning, any of these things, take care of it right away. If you can't figure it out yourself, talk to somebody like myself, like a holistic healthcare provider, because you don't have to know everything in your body. You just have to know where to go for help. I'm lucky enough to get to work with fantastic, excellent healers, and I spend a lot of time studying so that I can be a fantastic, excellent healer for you too. Okay, number 4, and this is especially important in Florida, because Florida is one of the areas where this one, which has a significant contributing factor to cognitive decline and Alzheimer's disease over time, and it's really, really, really a big deal in the hot, damp climate like Florida, like Texas, both places that I grew up. And that is mold, toxic mold. When you're constantly inhaling these things, like the window unit, air conditioners, you got to make sure to keep those clean. Your ducts in your house, you need to make sure to keep those clean, get them cleaned periodically, because that breathing in of the mold is not innocuous. And it is not just temporary. And it isn't just whether or not you're coughing at the time. Breathing it in over time can significantly affect your cognition. In fact, I know someone right now that their mother has been going through getting her kitchen remodeled because of mold exposure, mold problem in the kitchen. And the stories he's been telling during this time have given me indication to realize that this lady is she's not herself, right? She's more emotional, and she's having some difficulty with figuring things out. She's not as sharp as she usually is, and she's always been very sharp, which makes sense to me because there's a lot of mold that she's been breathing in that she hadn't been before. Number 5, vascular damage like atherosclerosis. So going back to the sugars and why it's so important to eat healthy foods and to not indulge in those processed sugars, because they aren't doing your body any good. We need healthy sugars in order to run our brain and our bodies, especially if you're an athlete. Nobody really needs donuts. Sorry. And number 6, this is the atrophic, the endocrine glands and the hormones. So if your hormones are out of balance, or if your endocrine glands are out of balance, your thyroid, your adrenal glands, and these can lead to Alzheimer's over time. So the moral of the story is, if you want to be smart when you're 75, if you want to have your brain, and especially if you're a lady, start paying attention to your brain now. Do the things that you know to do that are easy, that are within your control. Drink your water, eat the healthy foods, exercise, and meditate. And I also encourage you to consider working with a holistic healthcare provider, a qualified holistic healthcare provider, so that you can prevent your blind spots, because there are things that all of us can't see, and there are pitfalls that we might run into. Sometimes we don't even notice when we might have memory problems, but a caring, qualified professional can help you to see those things. Okay, I hope this has been of help to you, and I hope you have a really fantastic day. If we can be of service to you, please email office@longevitywc.com or call us at 941-923-9355. Thanks, and have a great day.